and welcome. It's 11 a.m. here in Seoul. I'm Choi Jung-yoon at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Son Young-rae, the Director General of Department of Strategic Planning at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in South Korea. He is to fill us in on the number of new cases seen as of midnight and what kind of efforts the government is making to contain the virus, especially with the first set of inoculation of the COVID-19 vaccines in South Korea, which started just a few hours ago. To give you a brief idea, we are now, the briefing is just about to start. Let's listen in.
We also have a sign language translation available. First of all, here is Director General Son Young-rae with the explanation on the briefing today. Let us now begin our regular briefing for February 26th, Friday. As of today midnight, we have 382 new local infections and 24 new imported cases. Yesterday, we had 4 more fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. We have had some adjustment to the social distancing scheme, and here are details. Starting from the 20th until the 26th, during the past week, on a daily average, we had about 374 cases, and compared to the previous week, which stood about 345, it is about a 16% decrease. And also, we have seen a third wave, and we also had many concerns of a possible resurgence of the virus after the Lunar New Year holiday. However, we do not see a major resurgence, and our daily tally hovers around 300 daily. And by region, in the non-metropolitan area, we have the 100 range of the new cases. However, we have about 75% of the local cases being concentrated here in the metropolitan area, and we have about high 200 range of our daily tally, and we have great risks in the metropolitan area. And as for the adjustment of the social distancing measures, we have been cooperating and listening to the opinions of many related personnel, as well as experts. And based on their opinions, we have been looking at and considering to also extend the current social distancing scheme for another 2 weeks. This means that in the metropolitan area, we have the level 2, and in the non-metropolitan area, we have level 1.5, just like we are doing right now. And also, we have decided to maintain the social distancing measures as for the following reasons. First, with the standards and the criteria of the social distancing measures, we have about 374 cases, which is below the threshold of the level 2. And by regions, in the metropolitan area, we have level 2. And in the non-metropolitan area, this means that we satisfy the criteria and the threshold of level 1.5. However, we still have continued outbreak here in the country, and we believe that if we stay complacent, we will have another major resurgence of the virus. And today, we are starting our vaccine rollouts here in South Korea, and we believe that we need to be very careful with our easing of the social distancing measures. In order to also effectively reach herd immunity, it is very important for us to contain further spread here in the local community, as this could also put an heavy burden on our medical resources. And we are also now in the process of preparing for a major revamp of the social distancing scheme. And in order to also have the prolonged discussions on this agenda, we have been agreeing to maintain the current situation. And to this end, we also will be extending these measures until the 14th. And this means that all of the school year plan for the new semester for for primary, middle school, and high school will proceed as planned. Moreover, the private ban on the gatherings of any for 5 or more people will also be maintained, and nationwide, all of the nightlife entertainment venues will also be allowed to operate only until 10 p.m., and they will also have to comply with the intensified quarantine measures, including having a visitor log, as well as prohibiting people from changing seats. And to this end, we will also monitor our outbreak, and we will also look into the risks of cluster infections. And especially at the office spaces and workplaces, we will look in detail at the cluster infections, especially those that are also clustered by the migrant workers here in South Korea. And as for the residents and the workers at nursing hospitals, they are currently subject to a regular massive testing, and we will also proceed speedily with our vaccination rollout for these people. And as for the places of worship, also the non-accredited religious facilities and also international schools that are related to them, we will also intensify our quarantine measures for these areas as well. And we will also abide by the laws and also have stern measures for any of the breaches or violations of these anti-measures. And we also want to highlight that many of our public are also doing a great job in participating in our antivirus measures. However, there are a certain number of people who are breaching and violating these means. And as for these people, we believe that they also put a great harm on our society, and thus they will be subject to stern legal measures. And as for these people who violate these measures, we will also have them to be subject to fine and penalty measures. And also, as for your information, we would like to note that as for those businesses who violate these measures, they would be faced up to 3 million Korean won as fines and 100,000 Korean won for individuals. And also, as for these core facilities that violate these measures, we will also be subjecting them to a gathering ban for the next 2 weeks. And also, if any offices or any public spaces have been subject to the administrative order of the gathering ban, they will also be singled out in terms of incentives or benefits. And also, as for people that put a hindrance on the epidemiological investigation and tracing, we will also have our indemnification clause, meaning that they will have to compensate for all of these confirmed cases and other related local transmissions that are stemmed from that person. And also, as for the government's indemnification committee, we also have a special committee, and we still have also a special team which are composed of experts to look into the details. And these measures are also very important, and we highlight the high level of civil awareness, and we believe that these are to protect our majority of the people and the businesses that comply strictly to the social distancing measures. We ask for your understanding and consideration as well as participation. And starting today, we are beginning the rollout of the COVID-19 vaccines here in South Korea. It is a very historic moment, historic step towards the return of a new normalcy here in South Korea. And we are embarking on this great journey until November. And the AstraZeneca vaccines to be rolled out today, and tomorrow we will be rolling out the Pfizer vaccines as well. And these two types of vaccines have already been administered to thousands and hundreds of people overseas. And in this process, we have seen the confirmation of the safety and efficacy of these vaccines, and these data are being accumulated as of now. And please consider these data, and please have confidence in the government's data as well as the guidelines that are rolled out by the government. So we ask for your participation in these measures as well. Moreover, despite the inoculation, it is is also it will also take a considerable amount of time for us to have hope for the effects of these vaccines. And at other countries, when we look overseas, we also see a possible resurgence of the virus cases even after inoculation. And we also cannot single out that we are nearing spring, which will also have a more movement of traffic. And this Tuesday, our movement of people also increased by 5.7% on week. And also, we ask you to also comply with the social distancing schemes even after inoculation. And we also ask for you to help us to contain the virus here in South Korea. Moreover, the government will also make sure that we can reach herd immunity safely and effectively. We will be basing on the scientific evidences and proof as we carry out our inoculation drive. And the social distancing effects, we also have a great confidence in this. However, we still have many side effects stemming from the prolonged social distancing measures. And looking at and considering all of these measures, we are preparing for our third revamp in the social distancing scheme. We are opening ourselves to the opinions of diverse circles here in the society. And next week, we will be revealing a draft of this scheme. And we will also be reflecting some feedback from the public. And we hope that we can come up with a sustainable plan together with the public. And we believe that quarantine and the return of our daily routines is the two sides that we need to achieve in a very fast pace. And until the day we have the return of our daily routines, the government will exert our pan-government efforts. Thank you very much.
That was a government briefing updating us on the COVID-19 situation here in the country. South Korea confirmed 406 new cases of COVID-19 on Friday, bringing the accumulated total to over 88,900. There have been 4 more deaths, raising the death toll to 1,585. That does it for our coverage of this morning's briefing. We'll be back at 12 p.m. Korea time with our midday news with Mark Brew. Bye for now.